Good afternoon, everyone, and welcome to the January edition of the Staff Wellness and Health Booster Sessions. Our topic this month is tips for setting limits with ourselves and others with Dr. Joanne Unger. My name is Chad Saxon. I'm the Communications Coordinator for the Addictions Foundation in Manitoba, and I'll be your moderator for this session. We will get to Dr. Unger in a few seconds, but we have a little bit of housekeeping items just to go through first. As we all know, COVID-19 has challenged health system workers to change how we conduct ourselves in the workplace, our home, and social connections. These changes can sometimes feel overwhelming. To support health system workers and the public, Shared Health and our Psychological Health and Safety Committee partners have brought together skilled trainers from across the province to facilitate a number of these staff booster sessions. Today's session will look at how part of managing challenging workloads and increasing stress levels is finding balance in our daily activities, asking for help when we need it, and learning to say no. For some of us, this is an internal struggle, and we need encouragement and tools to help us better balance our priorities and shift our expectations. Using elements from evidence-based therapy models, this session will encourage you to reflect on and potentially shift priorities for a more balanced life. You will also receive some tips on how to communicate those limits to the people in your life. As mentioned earlier, our presenter is Dr. Joanne Unger. Dr. Unger provides treatment and consultation services through her private practice, as well as treatment, consultation, and assessment services to children and families through her position in the Department of Clinical Health Psychology with the WRHA. She's also the president of the Manitoba Psychological Society and is using this position to advocate for better access to psychologists in Manitoba. Following the completion of her presentation, we will have a few minutes for questions. Also, today's session is being recorded and will be made available as a streaming video on demand on Shared Health's COVID-19 mental health resources page. And with that, it's my pleasure to turn things over to Dr. Unger.
Thank you for the introduction. It's a pleasure to be here today and to be able to provide some tools to help us maintain and maybe even improve our mental health during these continually difficult times. Just noticing my screen changed here. I've lost my PowerPoint. Okay, there we go. There are two main areas I want to talk about today, and they are finding ways to set limits with ourselves as well as setting limits with others. We often know what we need to do to help our mental health, but sometimes our inability to set limits acts as an obstacle for doing these things. I want to start though with a caveat to my presentation. The tips I'm going to share focus on things within our control and influence. The chart here, popularized by Stephen Covey, recognizes that not all of our stressors are within our control. There are many things that are outside of our control and yet impact us and are within our circle of concern, the largest circle. It may feel particularly large right now when our world, day-to-day lives, and jobs seem to be all dependent on this uncontrollable virus and the decisions made by those in power. I wanted to recognize this circle and its influence on us, our stress level, and our mental health. And I want you to know that by focusing on elements that are within our control and influence today, I'm not wanting to minimize the effect of these stressors that they have on our lives, even though they're outside of our control. They are real. I do hope that some of the tips I'm sharing today will help you improve your mental health, coping, and resilience in spite of this. So here's the outline for today. A very important tool in managing our stress, resources, and mental health is learning to set limits within areas of our control. For some of us, we can be our own worst enemy. We do not set limits for ourselves in areas where we actually do have some control, so we'll start there today. We will look at the matrix from the acceptance and commitment therapy model to help us decide which activities we should continue and which we might be able to let go of. Additionally, we'll look at how our expectations that we're holding for ourselves may not be realistic and causing us more stress than necessary. Should we discover changes we want to make in our lives to be more balanced, to take care of our mental health, and to let go of some of those expectations, we may need to communicate those to people in our lives. This will likely mean saying no or asking for help. As people working in the healthcare system, we may have a tendency to offer help well, but may be poor at asking for it. And this is common, but not sustainable in the long run. We will look at the skill called Dear Man from the dialectical behavior therapy model to help us learn how to do this well. We'll start by looking at how we might set limits with ourselves in areas within our control so as to be on our own team. The ACT matrix is a method to help us pay attention to how we're living our lives and if we're doing the things that matter most to us. When we do what matters most and move towards those people that matter most, we live a purposeful life. While stress will still be there, we will be living in a way that helps us to be more resilient and charge our batteries. We'll be using the matrix in a particular way today, focusing on behaviors of self-care that recharge our batteries. As I walk through this model, I'd encourage each of you to take a piece of paper if you can and draw a horizontal and vertical line through it, just like on the slide here. As I ask you questions, you can fill in the answers within the different quadrants on your own sheet. I'll start by explaining the matrix first. Using it to set goals and shift priorities requires us first to notice what's going on in our lives. We're required to notice our internal experiences, our inside thoughts, feelings, body sensations, stress levels. That's the bottom of the matrix. And we need to notice what's going on outside of ourselves, the top of the matrix. This includes our own behaviors and actions, as well as anything we can notice with our 5 senses. We want to notice what things inside and outside move us toward what matters most to us and recharges our batteries. That's the right side of the matrix. And what internal and external experiences move us away from what matters most and recharging our batteries. That's the left side of the matrix. The noticing, as you can see in the center of the diagram, is of a certain quality. In order for our awareness to be most helpful, we need to notice with kindness and with curiosity. We do not need to judge how we're living now. We just need to be curious and aware. Judgment just adds another level of distress that is not productive. We can use this noticing in the matrix to help us engage in more self-care and recharging activities and less of the things that do not recharge us. Let's go through it step by step. Feel free to start your answers today, but you may need some more time to finish later when you have more time to reflect. Due to time limits, I'm not going to be able to pause as long as I would like to after each question. So we will start by thinking about who benefits from us being charged. Certainly you will benefit, but others will as well. The answer to this question can be surprising and a helpful motivator. Reminding ourselves who benefits from us taking care of ourselves, recharging our batteries, regaining some energy is an internal dialogue that moves us towards recharging activities, bottom right quadrant. Leaving a minute to write a few notes down. And then what internal things like thoughts, beliefs, and feelings get in the way of doing things we know we need to do to recharge our batteries? They move us away from recharging. It might be thoughts like, I do not have time for this, this is selfish, or I'm being a burden. However, we know those are just thoughts, and they may not actually be true or helpful, and they move us away from recharging our batteries. We can write some of those internal experiences we're having on the bottom left quadrant of the matrix. So if we're not recharging, what are we doing instead? What are the behaviors, the outside things that we're doing that move us away from recharging? This could be working a lot, getting stuck on the couch, avoiding people, getting lost in social media. These are things that maybe can be helpful in the short term because they help us avoid some of our negative internal experiences on the bottom left part of the matrix, but they may not actually help us recharge our batteries. They kind of drain us. Those behaviors and things that we're doing that move us away from recharging can go in the top left quadrant. Then we need to ask ourselves, what are the things that do help us recharge our batteries? These are behaviors that move us toward recharging. There are some activities that are commonly recharging to most people, but there are other activities that are unique to us that we also find recharging. These can be written in the top right quadrant. And I have a few ideas to suggest that could go there. My top 4 suggestions that I commonly give for recharging and for positive mental health are making sure we have enough social connection in our lives, making sure we get enough physical activity, having fun and pleasure every day is really important, and having meaningful activity that are in line with our values. Now, the meaningful activity might come out in our work, but there may be other values that we have that we want to engage in some activities that will help in that area as well. These 4 recharging activities really have a lot of bang for their buck in terms of mental health. Additional recharging activities that are also helpful for a lot of people include making sure we get the right amount of sleep, drinking enough water, spending time in nature, doing something creative, relaxation activities, mindfulness practice, a gratitude practice, and giving back to others. However, the last one, again, if we're in the healthcare profession, we might be doing a lot of already in our jobs and with our families. And so that one might actually be covered or over covered depending on our situation. So based on how we answer these questions, we may need to set some new goals and priorities for how we are spending our time, at least the time within our control. And it may be a small window, I'm aware. This means setting some limits for ourselves by doing less of what's in the top left quadrant and more of what is in the top right quadrant. This can be hard to do. However, if we get in touch with our motivation for recharging, remembering who benefits from this in the bottom right quadrant, and setting small, realistic steps for change, we can start to shape our life into one that helps us recharge our batteries. For a little bit more on this topic, I've written a short post on making personal change for the new year that might be helpful. And you may also want to access Dr. Lee Bagley's resources, whom material you've seen on these slides. She has more on this topic that might be helpful. But before we set anything more onto our plates, it's really important to assess realistic expectations that we may be having, or unrealistic ones that we may have for ourselves. A lot of stress, self-criticism, judgment, and mental health difficulties can be due to the difference between our expectations for ourselves, other people, and the world around us, and the reality that we live with. If our expectations for ourselves are unrealistic and actually not possible for us to achieve, when we do not achieve them, we are hard on ourselves. We are commonly told that this means we need to try harder, work more, be stronger, or else we are the problem and a failure. However, the problem, particularly for helpers and high achievers, may actually not be how hard we are working, but our expectations of what is possible for us in this moment in time. Here are some examples of unrealistic expectations people might have right now. I should be able to do as much as I was doing before the pandemic. I should be able to work overtime, support my family, and take care of myself as long as it is needed. The reality is, constant change, adaptations, and increased workload use up resources. We may not be able to do all the things that we could do before because our stress system is being taxed just by being in a pandemic. Also, while may be possible in the short term, overworking or chronic stress in the long run leads to burnout and mental and physical health problems. Just because we work in the health industry does not mean we are immune to the basic human principles of resource use and stress management. If we are not getting done what we think we need to right now, if we are struggling to meet our goals and expectations, it is likely our goals and expectations that are the problem, not us. So I recommend to use a self-awareness practice to assess our resources, our stress level, our goals and expectations. And if we're falling short on our goals, maybe we adjust the expectations. Changing our expectations, letting some things go where we can, of course, in our areas of control, and only adding things consistent with our values and to build a resilience is a way we set important limits for ourselves. So make sure you're working to have realistic expectations as you set limits and engage in recharging activities for yourself. I recognize this is easier said than done and can be a bit of a journey, but one worth traveling. Once we've decided where we need to set limits with ourselves, these may need to be communicated to others and could involve setting limits with others as well. This often involves saying no or asking for help. One of the best skills I have found that can help us to do this well is the Dear Man skill from the Dialectical Behavior Therapy model by Dr. Marsha Linehan. Dear Man is an acronym, and I'll go through it. The Dear steps are what we might say, and the Man steps are how we say it. The D stands for describe. So when we're talking to another person where we need to set a limit with them to say no or ask for help, we describe to the other person. We start with just the facts of the situation as we see it, trying to be objective as possible at this point. To be taken seriously, and for the other person needs to see that we see the situation clearly and objectively to begin with. And then in step E, we express how we feel about the situation. They may not know how we feel because people feel differently in the same situation sometimes. And so we need to tell them as clearly and calmly as possible how we're feeling. When we describe our feelings and opinions, we indicate that we know that they are our perspective by using the word I. This shows that we understand that others may feel or think differently. And it also reduces defensiveness. Saying I want or I feel instead of you should is much better received. And then we assert. We ask for what we want, or we say no as clearly as possible. Again, we can't assume that others know exactly what we need or want, or be able to figure that out without us asking or saying that. We have to state it clearly. And then the R stands for reinforce. We let others know how giving what you want in the situation also benefits them, or how much you would appreciate it. If people do as we ask, remember to reward them or reinforce it in the moment by saying thank you and that you appreciate it. So that's the what we might say. And the M is, the Man stands for how we might say it. So the M is staying mindful. While we're having the conversation, it's important to stay focused on our assert or our ask. Others might try to distract us to other comments or other situations or divert us from what we want to discuss. And so we can stay focused by being a bit of a broken record and calmly going back and repeating the request over and over again, ignoring unhelpful or destructive comments from others. The A stands for appear confident. Now, we don't have to feel confident to appear confident. Using strong tone of voice, posture, and eye contact can really help others to take us more seriously and show that this is important to us. The N is to negotiate. Now, this is not the same as giving in. It means, though, having a bit of flexibility in our goal or in the way that our goal will be met, and a willingness to listen and take in another's perspective. If they don't like our request, we can ask for an alternative that they may have to have the goal met, and maybe even brainstorm together if it's not your request doesn't work for them. Here are some examples of how we might use these steps to say no or to ask for help. So for saying no, someone might say, I have worked X number of hours, whatever that is for the person this week, and we'll be doing this again next week. That's the describe. The express is, well, I really would like to help you with this project, whatever it is they're asking you for. I am very tired, that's my feeling, and have limited energy. The assert or the ask is, I'm going to have to say no at this time. And the reinforce is, I really appreciate the work you're doing, and I hope you can understand that I just can't do this right now. And here's an example of how we might use these steps to ask for help. The describe is, I have worked again X number of hours this week, and we'll be doing that next week, just what the situation is. The express is, I'm really tired, worn out, and struggling to do things around the house when I get home. And the assert is, I was wondering if you might be able to make double batches of your suppers for my family once a week. And the reinforce would be, I can pay you for the groceries, and this would really help my family have healthier meals and for me to get more rest when I am home. I would so appreciate this. If this is a new concept for folks, it can take some practice. I often recommend writing out what you would want to say and practicing it ahead of time. This is particularly helpful if we are anxious about the conversation or we expect a negative reaction. Getting input from or practicing with others can also be helpful. You might even want to try the steps out in low-risk situations and low-risk people first. To summarize, within circles of our control or influence, It's important that we try to set limits with ourselves by engaging in recharging activities and setting realistic expectations, and setting limits with others by saying no to extra things within our control and asking for help when we need it. Because asking for help is often difficult for those of us raised in an individualistic culture, particularly if we're helpers ourselves, I wanted to end on this quotation that I found while preparing for this presentation. Requiring help isn't bad. It isn't weakness or failure. It's a sign that we're human with limits. We're all people and we all have limits and needs. We need to support each other to get through this, and this means sometimes we need to ask for help. Thank you. And now I think we have time for questions.
Yes, indeed. Yeah, thank you very much for that presentation. It was great, and I think lots of really worthwhile and pertinent information given given the times we are in. We don't have any questions at the moment, but I was kind of curious just in the importance of practice in saying some of those like asking for help. I can just speak to even to myself.
Yeah.
It almost makes me break out in hives when I think I have to like ask people for something. I hate it. And so like how important is practice in being able to sort of maybe break that barrier?
Yeah, absolutely. If it's something that we really struggle in, I usually really recommend practicing in really low risk situations. And what I mean by low risk is where, you don't have a lot of anxiety, where the relationship is really safe. You feel really calm with that person, or the ask is really small. And then even writing out those steps, I often really encourage that ahead of time. And all that preparation helps to bring some of that anxiety down, and then that practice for when we're in those high risk situations can be really helpful. I know we tend to, for good reasons, often be kind of conflict avoidant, and saying no and asking for help are two situations where people might feel that there could be pushback, that there could be a reaction of some type, whether that's real or imagined, that can sometimes stop us from setting a limit with other people. And so, really recognizing, and this takes, again, time and practice and a bit of a journey, that, having those discussions, we're still safe. It can still, well, depending on the situation, of course, to say no to someone, it depends on the situation, but it's my responsibility to know what I can do and can't do, and the other person isn't going to know that. And if we don't give them the opportunity to have that information, they will continue to act without it. And so it's their responsibility to manage their reaction to us, and we don't have to worry about what the implication is for them. So for example, if I ask someone for help and they're really strapped, it's their responsibility then to say, you know what, I really can't. I'd really like to help you, but I'm overburdened as well, and I really can't right now. And then we go, oh, no problem, I totally understand. And then we can try somebody else. So recognizing we don't have to own another person's response to our saying no or asking for help. That's their job, and we're responsible for ours. I don't know if that answers your question well, or.
No, I think it does. Absolutely. No, I appreciate that. Sort of on that same topic, we had a question, how do I combat guilt when asking for help? The person noted they feel like they're failing but when they ask for help.
Yeah, so I think that goes to, again, that last quotation, and something I really, really firmly believe, that I think we get trained in individualistic cultures out of this. And I really believe we are, as human beings, meant to live in community. We are meant to help each other out. We are a flock or a herd animal. And that is really how we're designed. And so if it's our turn to ask for help, particularly, when we are being asked to help our whole society by being healthcare professionals and being on the front line, that we need something in return or we need support at some point is completely reasonable. And so that guilt comes from a belief that we may have about what asking for help means. And so we need to unpack and maybe unlearn what asking for help means, because we've got it connected to being a failure or being a problem, when in fact, I would say that it is a normal part of living life, is that sometimes we offer help and sometimes we need it. And that's a balancing act that we will have in different relationships and over our whole life. If we are only ever the helper and never get help in return, that's not sustainable. That's how humans work. And so there's some core beliefs about getting and receiving help that we may need to unpack and unlearn to let go of that guilt about asking for help.
Well, that's interesting. I think it's something that a lot of people do struggle with, for sure. I had another question here. What is the way to determine you're starting to struggle with too much before it gets too late? I ask as I was in the too far gone situation recently and ended up having to take a lengthy leave of absence and get some psychological help.
Yeah, absolutely. And that you are not alone. I see that a lot. It really is about developing a practice of self-awareness. So there was that one line at the bottom of the slide with the having to do with expectations and having those realistic expectations. And it talked about setting up a self-awareness practice. And so that means we need to learn to pay attention to us as we're living our lives. And that includes, our stress level, our emotions, our energy level, our thoughts that are going through our heads. What are our warning signs? So if you've been in an experience where you've had to take a leave or you've experienced burnout before, to use that time to go back, what were the warning signs I missed from myself? And how can I set up a check-in with myself that works for me, where I'm paying attention, on a regular basis to what my energy level is, what my mood is like, what my stress level is, where do I feel it in my body, what were the cues that went unnoticed before. There's some, sometimes taking a stress checklist, right, on a regular basis to kind of look at where we're at in terms of our mental health and our stress levels, just as a check-in, so that we don't miss when we're moving into that burnout phase and we have to take a leave, are some of the things I would suggest.
That's great. We're coming up on 12:30 here quickly, so I just we'll get to one more question, and we touched on the guilt of asking, but somebody is wondering about what is the how do you deal with the guilty feelings of rejecting or saying no?
So some of the same strategies there, in that nobody knows where you are at in terms of how much energy you have, what else you're doing in your life, what resources you have available to meet the need or the request of the other person. Nobody has that information except you. So the person who's asking you for something, they don't have that information. They don't have that knowledge. They're asking because they need some help, and they're looking to where they can have it. And we are the only people who can tell the other person whether we have it or not. And if we say yes and we don't have it, then we're gonna become like the last person and a lot of people, where we've said yes to the point of we can't do it anymore. We're past an empty tank and we're burnt out. And so by saying no, we're the only person that can set that limit with other people. And so again, going under, what is the meaning of no? What is the meaning of setting a boundary that we have for us in our lives? And do we need to look at that and change that and recognize, instead of saying, no makes me a bad person or unhelpful or uncaring, actually no means I'm taking care of myself. And that other person isn't going to know what we have in our life, and hopefully they'll understand when we kind of explain, I just don't have it in my tank. And if they give you a guilt trip, then that's on them, and try to let that go and push that back. But it's hard. all of these things take practice and time, and I know are much easier for me to say than to do in the moment, but kind of worth the process to doing.
Oh, that's great. That's some excellent advice there, and thank you to everybody for the questions, and of course, thank you for the presentation today. We did have a question regarding the slide. If somebody could see your slides, we do post the slides afterwards to the Shared Health resources page, so we'll make sure to try and get those up there as soon as possible so people are able to access them. The other thing I wanted to mention is that we have another session scheduled for February. We will be back on February 17th, 2022. And the focus on that day will be mindfulness, compassion, and spiritual health in our work and in life. Information on how to register for those sessions, for that session in particular, will be shared via the usual email channels. So again, I just want to say thank you very much to you, Dr. Unger, for today's presentation. I think just some great advice and a lot of things that, again, practical advice that people can take into their day-to-day life. So really appreciate that. Thank you to everyone for attending, and we'll close there.